Mrs. Johnson goes to see her GP, David Brown. She is 65 and suffers from cardiac arrhythmia. Her condition is not life-threatening, but it does worry her. This is her third visit to the surgery in a short time. David refers Mrs. Johnson to the cardiologist, mainly to put her mind at rest. After his surgery hours, David calls his colleague John and says he's had an idea. It would be much more convenient to Mrs. Johnson if she received telemonitoring at home. Furthermore, because it will help ease her concerns, her symptoms will lessen. Home telemonitoring is arranged in consultation with the cardiologist, and Mrs. Johnson can contact the cardiac nurse during the telephone surgery hours. The cardiac nurse also maintains contact with the cardiologist. David and John have around 50 patients like Mrs. Johnson. Making a change like this will of course affect many different things. In order to monitor these effects, TNO was hired by Zon MW to develop a business case tool for long-term care. This tool systematically gauges the effects of the change and the collaborations between various parties, such as in the case of Mrs. Johnson. For example, it results in an expansion of the tasks of the cardiac nurse, yet it saves David and John 2 consultations per month. The number of consultations with the cardiologist will also be reduced. The cardiac nurse's extra hours are compensated by a lower number of referrals to the cardiologist. The change will also result in cost savings of €50 to €100 per patient per month. This will certainly convince the health insurer to agree to the change. As home telemonitoring will also help reduce Mrs. Johnson's anxiety, the chances are that she will experience fewer health problems. By having more contact with patients, the cardiac nurse's work becomes more interesting, and the workload of David, John and the cardiologist is also reduced. Mrs. Johnson and the 50 or so other patients with similar complaints will be referred to the cardiologist less frequently. With the business case tool, all parties involved can clearly see how feasible particular innovations are and what benefits can be realized. Register now and create your own business case via www.businesscase-longtermcare.com. The business case tool for long-term care, for clearer decision making.